Hello, this is a video on how to do a cat and cow movement. Either if you've never done it before, if you're not sure if you're doing it properly, or if you have been doing it but you would like to work on being able to do segmented movement and move different parts of your spine individually. So here we're just in tabletop and we'll start with the neck. So cervical spine, begin with extension. So you're contracting the muscles along the entirety of your neck all the way to the upper part of your back. When you are reaching your head up, you're breathing out. When you're bringing your nose down to your chest, you're breathing in. You're really trying to feel that movement again from that very, very top of your upper back all the way to the base of your skull when you're moving back into that extension. And when you're coming forward, try and bring your nose as close to your chest as you can, your chin all the way down to your chest, whatever movement you can make. If this isn't the entire range of motion you can achieve, that's okay. Work within the range of motion you can achieve. Breathing in as you chin to chest, exhaling as you bring your head up, looking in front of you or looking up to the sky. Couple more times and then we'll move on to the thoracic spine. When you're done, bring your head back to neutral. Now, if you're not sure how to do shoulder protraction and retraction, you can find another one of my videos to learn how to do that. But for now, basics, you're thinking about squeezing your shoulder blades together in your upper back. This is scapular retraction. Then you are going to push through the palms of your hand, push the floor away from you, round your shoulders forward. Think about really feeling your shoulder blades move around and forward, and that is protraction. You can see that my spine is automatically bending and extending with this scapular movement. As you're doing your scapular retraction, this is your thoracic extension, so you are thinking about trying to get a bit of that upper back bend. This is not where a lot of mobility is going to be coming from because our thoracic spine doesn't have a lot of mobility, and that's okay, and that's very normal. So you can see I'm keeping my neck neutral, I'm keeping my lower back and core neutral. Again, so when you're pushing forward and you're rounding your upper back, you're inhaling. When you're dropping your chest towards the floor, retracting the shoulder blades, you are exhaling. So inhale, push and round. Exhale, extend your back, retract your shoulders. Personally, I find this is the most difficult movement out of cat and cow to achieve, is this thoracic extension and flexion. If your wrists are ever feeling like they're getting sore, please remember, push the floor away, try and grab the floor. Let's return to neutral and move on to the lower back, the lumbar spine. So this one's probably going to feel like your easiest, but you're thinking about tilting your pelvis forward, arching your low back, your butt's going up to the sky. And then when you're moving into your curled up position, try and think like you're a little doggy. You're pulling your tail under between your legs like a scared puppy. You're also thinking about pulling your belly up towards the spine and rounding out that low back as much as you can. So inhale, tuck your tail, pull your belly to your spine. Exhale, let your belly go to the floor and arch your tail up to the sky. Inhale, pull your belly in as much as you can. And exhale, tail going up to the sky. There is definitely a lot of mobility often available in the low back, and just doing this segmented movement is really great if you have any low back injuries that you're trying to rehab so that you don't lose your lower spinal mobility. Because once you start to lose that, it just goes domino effect up the entire chain. I think it's also important to note that as you're going through multiple rounds of this, no matter which section of the spine you're doing, really check in with your body. What do you feel moving? What do you feel contracting? What does it feel like? And when you're feeling what it feels like, can you feel both sides of your back equally? Does the right feel the same as the left? Can you feel both contracting equally? Or does it feel like you're very aware of one side and you don't really feel the other side? If that's happening, what can you do to better activate and feel the side that's not really working. Great job. After this, you can keep doing segmental work or return to a full cat and cow. Thanks for watching.